Hello there, this will be the fourth and final part of Unit 2 Digestive Diseases. I tried to chunk these up into 15-minute or less segments, make it a little easier for your listening pleasure, I hope, as you review this particular section in plant animal disease. So let's jump in and talk about the final three topics as we bring this section home and hit on scours, coccidiosis, and salmonellosis. And as we move ahead and look at scours first, and many of you, if you've dealt with livestock, have probably dealt with scours. Affects basically every livestock species that you can think of that you would encounter at home on the farm. And so if we look at foals specifically, it's actually oftentimes not very problematic. It may be caused by a mare that's in heat right after foaling, simple diet change. Maybe a mild infection or even a parasite that they've picked up somewhere out there if they get out to grazing. Clinical signs in horses is, again, it's usually pretty mild in horses. Watery, smelly diarrhea is common all the way across all the species that we'll talk about. And so for the first, let's say, day to 2 days or day and a half, you'll see profuse diarrhea, and a pretty poor appetite. And so that's why you have to worry about dehydration. And electrolytes are really, really important here. I think you'll see that as we go all the way through. So preventative things when we talk about horses and scours is simple sanitation, making sure that they get adequate colostrum. That's really important. And then again, there's no vaccination for this. But you maybe sometimes want to avoid some kind of stressor like vaccinating them if you feel like they're already maybe a little bit susceptible to some kind of problem like this. If you see treatment, or if you see a severe enough problem, you'll need treatment of electrolytes and fluids, potentially call the vet. If it's mild, like most of us have dealt with mild cases of scours, if you've ever raised young stock at home, just monitor closely for other symptoms, check body temperatures on a regular basis, make sure that they're drinking plenty of water. I've even seen folks use Gatorade or Pedialyte, something like that, to help restore their electrolyte balance in their body. Is sometimes just a good, simple household measure that you can take. Now, contrasting scours in horses to pigs, it can be extremely, extremely highly fatal, and part of that is because of the pigs being raised in close confinement. It can spread very quickly. It usually occurs in pigs the first just few days of life, and it's caused oftentimes in pigs E. coli. And because pigs don't have much hair and have trouble controlling their body temperature, they can get stressed pretty easily in that farrowing barn or young stock pen, and you can get this rolling through your pig barn really, really quickly. So, and also you can get scours and kind of an infection in the navel cord causes it. They can eat infected feces. Maybe your feeding program for your sows isn't quite up to snuff. There's a lot of different causes for scours in swine. It's one of the bigger problematic ones and ranks near the top in terms of swine deaths in the farrowing barn. Clinical symptoms: that really watery, smelly, yellow diarrhea. They'll lose a lot of weight, and little pigs don't have a lot of weight to lose. And then you'll find some secondary infections that'll set in, whether it's pneumonia, actually perforation of the abdominal lining, some kind of ulcer. Mortality rates can be extremely high and all the way to 100% if you get it really bad. Prevention: this is part of why you see swine operations very, very high and keen on sanitation and disinfection. If any of this starts to set in, they're going to go really quickly with broad-spectrum antibiotics, sulfamethazine drugs administered through the water, vaccinate the sows. Sometimes you can even, I've got listed on the slide an endogenous vaccine. And what that means is essentially you've had a veterinarian come to the farm and swab and look for the specific pathogen that's causing the scours on that particular farm, so that you can go then back to the laboratory and actually make a vaccine that is unique to that operation, so that you're treating that particular bug instead of going with something very broad spectrum vaccine that may or may not include an agent that will work against the specific pathogen that you have. I've seen that used on operations. It is quite effective. Next, we'll turn our attention to calves, and generally three contributing factors, and the biggest one of the three right there is stress. The second one is oftentimes infectious organisms, and probably ranking third, and even though I have it listed first, is faulty nutrition. Our nutritional programs are so good in calves anymore, whether we're talking beef calves or dairy calves. Most of the time, that shouldn't be the problem. It's oftentimes associated with stress, whether that's cold stress, heat stress, infectious organism stress, something of that nature. Again, very, very serious health risk in calves, and it's caused by a bunch of different things here. You can get E. coli, and if it happens the first 3 days of life, it's probably E. coli scours. If you get it from day 5 to 15, it's probably rota or coronavirus scours. So that's important distinction to notice when you're diagnosing which treatment protocol and which type of medication to use. Clinical symptoms, this one again, same type of watery diarrhea, same type of problematic area. They'll be off feed. One of the different things you'll see is actually their nose and extremities, their ears will get cold. You'll actually see them sometimes shed a little bit of hair. Obviously, they'll back off on feed intake and a number of different things to go with what you see. They're always going to be febrile and carry a pretty good high temperature. That calf, again, it's going to get unthrifty looking. They're probably pot-bellied, rough hair coat. So how do we prevent scours? Well, reduce exposure in newborn calves, and that's simple sanitation. Making sure that they get great and as much colostrum as you can get them to drink. Vaccination of the dam 2 to 6 weeks prior to parturition is a perfect way to help cut into your incidence rate in scours. Treatment, oftentimes get them off for milk, and that sounds weird to say, but sometimes the substrates that go along with feeding milk are perfect for the bug that's already causing them problems, and so sometimes you got to pull them off of milk for a couple, 3 days. And so make sure you're administering plenty of fluids then, lots of water, lots of electrolyte to try and get them back on their feet and turned around and going the right way before you reintroduce milk back into the diet. And you're going to associate some antibiotics with that. Somewhat related to, in terms of what it looks like, but a different disease altogether, is coccidiosis. When we talk cattle, sheep, and swine, especially in confinement situations, coccidia are carried normally by mature animals, and we shed them in fecal matter. Your lower intestine, your rectal cavity, oftentimes carries coccidia, and they just don't proliferate enough to cause any kind of outbreak. And it's kind of a normal bug that you carry, so to speak, and many times you can kind of almost become resistant to it as an adult animal. But as young stock, if they pick up that protozoan coccidia, it can cause a coccidiosis outbreak, and it's there's a number of different things that are listed here on the slide. Birds carry it, so you have to kind of worry about bird populations on your farm, which carry a number of different things, and we'll talk about another one here in just a minute. Sometimes overcrowding, just feed changes will set that off. So coccidiosis is, again, very problematic. You'll see it generally, we just talked about diarrhea, or talked about scours in calves that first 3 days E. coli, 5 to 15 days rota or coronavirus. Coccidiosis is about day 14 to day 21 or day 14 to day 28. You'll see them set in. If they're going to get coccidiosis, it's probably right in there. You're going to get diarrhea. This type of diarrhea, though, is sometimes gray. Also smells very, very pungently, but it's oftentimes a different color than typical scours, which is more yellow and watery. This one is sometimes gray in nature, and oftentimes streaked with blood as they shed that lower intestinal wall because of the infection. So prevention, make sure that you don't have any contamination in feed and water. If you had a calf in the calf hut or in the stall, the pen that had coccidia before, clean and sanitize that area. Get it exposed to the sun. High temperature water helps. Any affected animal, quarantine them. Do whatever you can to break the life cycle of that coccidia bug. Feed an ionophore, and I'm talking like decoquinate or Decox. Losalicid is Bovatec. Those are the two main feed grade ionophores that'll help control or prevent coccidiosis, and Proleum is a medication that you can put in the feed or water that helps kind of control it as well. So that's coccidiosis. Again, not nearly as common as scours, but something to clearly look out for. It does cause death if you don't get right on top of diagnosing, treating, and controlling it. Lastly, as we bring this section home in part 4 here, is salmonellosis. And there's two forms, whether it's digestive tract salmonella or genital tract salmonella. And that is both are quite problematic, but the one that we'll focus on here is digestive tract salmonella or paratyphoid dysentery, and it affects young or old animals. It is not picky here. It can infect the meat of the animal, so this is a zoonotic disease or zoonoses. So if you ingest meat of an infected animal, it could pass right to you and pass back to animals in feeds. So it's one that you do have to worry about. Really troublesome here is we've got more than 1,000 salmonella species that can cause this problem. And so it's really hard to nail down which one that you have sometimes. Clinical symptoms of salmonella: depression, again, weight loss, high fever, very waterous, blood-streaked diarrhea, and I've seen this more commonly in adult cattle than calves, and it kind of is widespread running through a herd. If you have pregnant females, you could see abortion rates jump. So prevention, you usually have to do more control than prevent. Be careful when you're introducing new animals into the herd. I've seen salmonella that is brought in on new animals, and then it contaminates a number of other animals in your herd. Birds is a real problem here. As you see, these flocks of birds that fly from farm to farm, and oftentimes they like to roost in the feed area. That's a nice warm and out of the wind space for them. And so they'll defecate on the feed and contaminates the feed. And if those birds are carrying salmonella, that's a prime time way. And it's been tracked and documented a number of different ways caused by avian contamination. So try and quarantine any infected animals. Be very proactive on this, and then you're going to treat with pretty high levels of antibiotics. And as far as the bird control thing, there are plenty of options out there in bird nets. Be careful for some of the other things that you go after, because some of them are not legal. Some of them you may cause problems with the EPA if you have birds that are poisoned and go and die somewhere else. Be very, very cautious about what strategies you use for bird control, and consult an expert if you need that. But be proactive on preventing salmonella rates. That wraps up these 4 sections. Unit 2, one of the longer sections of the whole entire course on digestive diseases. Again, metabolic problems are very problematic all the way through the herd. Digestive problems, no matter the species that we're talking about. So that's why we spend quite a bit of time trying to cut across all different species. And these would be the major ones that you're going to encounter, some more likely than others. But certainly I think we've covered the prime time candidates of digestive disorders that you might find on the farm. Hope you've enjoyed this section. Good luck on your assessment. Hope you do a great job.